What's up, YouTube? This is your daily dose of mental health, and in this video we will be discussing cannabis withdrawal. I thought I'd go ahead and do this video because this comes up more often than you would think, especially for people trying to get new jobs and whatnot. And I've personally actually went through this myself when I was in high school and college. So yeah, please like and subscribe to the channel. It should be in that bottom right hand corner somewhere in there. And once again, sorry for the quality, but I will be getting a new camera once I get a new job, which should hopefully be decently soon. So first and foremost, what we will be starting with in this is just basic marijuana withdrawal, and is it real? Some would argue it is not real. Others would argue it is very real. And my common approach on this, and once again, I can't give medical advice. I am an RN, but I can't give medical advice to anyone. I'm not a doctor. However, I can give my own personal experiences if I've had any, or I can give generalized patient experiences that I've seen in the clinical practice. So typically, if you're just smoking some cannabis on weekends only, and you're not really during the week, and you have to take a pee test, and let's say you have, a couple weeks notice, even a week, you should be okay, as long as you're working out and not consuming it. That would be considered a light smoker. If you're smoking like every other day or whatnot, now keep in mind when I say that, how much are you smoking? Like I was saying with the weekend, if you're smoking, sharing a joint, so you're smoking maybe a quarter joint with some friends, you'll have it out of your system in a week. Now, if you're overweight, that might be another thing. However, generally, if it's just that, your body will metabolize it by the time of your drug test. Now, if you're smoking every other day and you're smoking a full joint or a half joint by yourself every other day, you will probably want to at least have, in my opinion, 10 days of trying to push it out of your system. And a big key factor is everyone's different depending on metabolism, as I just said. If you have a fast metabolism, if you have a fast one, that is, you can get it out faster, and it has to do with your body fat. Because remember, cannabis, THC, sticks into your fat. It's fat soluble. That's the crazy thing about a lot of other drugs, like, your hardcore stuff. A lot of your hardcore drugs, even like, for example, meth, oxycodone, hydrocodone, some things like that, they aren't fat soluble. You can push them out of your system. I mean, I've seen heavy meth users who are using meth, and they have it out of their system within literally a day, and they're smoking meth every day, or injecting typically three days. But that's insane with like cocaine. Methadone is a little bit different though, and Suboxone, that stays longer in your system. But when it comes to cannabis or marijuana withdrawal symptoms, things I personally had when I was smoking, and I was smoking actually, I'm not going to say I was a heavy user, I was a moderate user, so maybe like every other day for a while, half bowl worth or whatnot. I was probably doing it, probably a half bowl, so maybe like a half gram. The big thing I noticed, I didn't really have any withdrawal symptoms, except I did notice my sleep was a bit weird. I noticed I had a lot of very vivid and lucid dreams. That's one thing you will notice. A lot of people use cannabis, which I'm an advocate for sleep. It's better, once again, long term. It's a better way to help with your sleep compared to something like Ambien. But typically when I was smoking marijuana and whatnot, I had dream suppression, which is common, and then when I quit, I would just have these, not really nightmares, just very random, vivid dreams. So that was pretty common. I also know, for example, that Joe Rogan has a podcast, and he talks a decent amount about marijuana and whatnot, and he's had some very good doctors on there discussing it, how it can cause psychosis and whatnot. But when it comes to when you're getting off it, there are some drugs, if you quit cold turkey, you can have seizures, you can go into psychosis. Marijuana, from what I've seen, that is not common. It's a lot of generalized feelings, like some people report some anxiety, some depression, just some sluggishness, very boring, heavy eyes, tired, Everything seems boring to them, and it does. I actually see on the American Addiction Centers, it does say some people have very disturbing dreams and even nightmares. Now, for me, and from people I've seen, and this is from heavy smokers, from moderate and heavy smokers, what they've said is they just noticed they just have more vivid dreams. And I did have the first couple nights. Insomnia can be described as a very broad spectrum term, in my opinion. Meaning, did I roll around for an hour or so? Yeah, but I've kind of always had that. Anytime I have something something new that I'll be doing the next day, I always have a little bit of insomnia. But insomnia, yeah, but not enough to make it where I couldn't sleep. Now, I suppose that could be something, and I could see that happening because people use it for sleep. But I can almost guarantee you, compared to like Ambien, somebody who's taking Ambien, and there's different reasons people would take it, which I don't oppose, but Ambien, if you quit that cold turkey, you can have true insomnia if you don't taper, meaning you're like, I want to freaking sleep, but I can't. It's not like this rolling around for a couple hours falling asleep. But typically, you'll hit a threshold where, so here's marijuana, here's Ambien right here. Ambien's this one. So when you're quitting, the first couple nights, let's say you're getting really increases in sleep. Let's say when you're using the substances, your sleeping is increasing, and this is your Ambien, this is your cannabis. So you're getting good sleep. Now let's say you stop both of them. Let's say that patient A stops Ambien, patient B stops marijuana. Let's assume they're both on the end of heavy. They've used Ambien for a long time. They're a heavy marijuana smoker. Typically, it starts out so your sleep quality really decreases. But even with a heavy user with you're going day 1, day 2, day 3, then typically, actually by about day 2 or 3, your cannabis over here, your sleep will start plateauing and you'll start sleeping more in and out. But with Ambien, it just continues to go down and down and down and down. And that has to do with the receptors it's attaching to in your brain. Depression I didn't really have. Maybe the biggest thing I had might have been psychological. Just it was more of a habit forming thing, meaning it was just breaking the habit of, for example, after getting all my work done and whatnot, wanting to go smoke a bowl, and playing some video games or something. So yeah, but back to like the P test and whatnot. If you have a higher body mass index, if you are on the heavier side, naturally it will take a little bit longer to get out. But if you're only smoking once every weekend or whatnot, you should be fine within a week of getting a drug test. Now, the big thing I will emphasize though is if you never think, oh, I've got a drug test tomorrow, I'm going to smoke tonight and try to cover it. Let me tell you, fake urine and stuff doesn't work. It just doesn't. It's not worth the risk of getting caught doing it and possibly getting a felony for it, or them not giving you the job, and then it can cause that is illegal to do. I would not recommend that. If you can't pass the P test, look, say you're sick, do what you have to do, but do not try the fake urine route. Do not go to a head shop, smoke shop, and go buy some. But yeah, when Joe Rogan talks about when he has people, he's talked about people who have different types of withdrawal, which isn't really a thing. It's not really weed withdrawal. He actually has done where he does like the 30-day sober October or whatever it is, or the sober October, where he describes it not really having withdrawal. But when he has people on discussing, they talk more about the psychosis route of it. Now, typically, to conclude with this video, the last thing I want to hit on real quick is it is your responsibility, and I'm just going to say this, even if you're a heavy user, the withdrawals, if you have something you need to do and you need to quit for a while, you need to quit it, you can do it. There are some over-the-counter remnants you can use, meaning one thing is a lot of those sleepy teas can help. Once again, kratom. Kratom could be a good substitute for a while, in particular if your energy is low. But the big takeaway is you do have to give your body to get out of your system if you're smoking every other day or every day. I know this is kind of an odd video in regards to mental health, but I just thought I'd throw this video out here because it's something that we see common, different types of withdrawals in regards to THC. I will be doing another video later this week, maybe tomorrow. I was supposed to do a video Monday, but had some stuff come up. I'll probably do a video in regards to just kind of a life update and how I'm doing with my personal drug recovery, which you can, if you check out my channel, you can check out the tramadol withdrawal I've went through, and I'm still going, still beating and whatnot to this day. I'm still clean, and things I use, and all my other mental health videos I put out. You'll see there's a lot of bouncing back and forth because with mental health, the daily dose of mental health, I'm just going to cover one thing in regard. Every video will cover something different in regards to a different mental health disorder, a different, covering different drug experiences I've had or common drugs that people have questions about. Because I'm not going to be real honest. You read some stuff on the internet on these Reddit, whatever forums and whatnot, and you read and I go through these. Like, for example, I put up a video about if you're curious about marijuana, already vaped weed, eating it. If you read some of those forums, I'm telling you right now, you'll end up, you might honestly end up in the ER with with the doses they tell you. Like, eat 2 tablespoons of already vaped weed. Come on, give me a fucking break. That's insaneness. But yeah, just check out all my videos. I'm just trying to reduce the stigma and give you some accurate mental health advice from an objective standpoint and my own subjective standpoint as well, and through clinical experiences. And I'm going to make this clear now. I am an advocate for whatever helps you, meaning if there's medications that help you, I'm not anti-medication. I'm a nurse myself. And I'm not anti if you're against medication. But in the comments, just put if you're ever going to comment saying, oh, I don't think this should be legal, this should be banned, you can feel free to put that, but let's not start any arguments or anything. Everyone is entitled to their opinion, but at the end of the day, let's respect each other, because if whatever is helping you in a positive way, and you're getting back to your normal ways and your sober self and what is making you contribute to society in a positive way, that's what matters at the end. I love you all. Look out for some new videos. Leave me some comments on some videos you want me to do. I'm very new to the YouTube world. My videos go everywhere. I guess I'm still kind of trying to find my niche, as they say, but I really don't care about that. It's just generalized mental health, as I said. Peace and love, and look out for another video coming out later this week.